I'm Hannah Bilthouse. My student ID is 2973725, and this is my laboratory animal management class. I'm going to talk to you a little bit about the rat first. This aquarium I got for him, and I'm actually going to keep this rat. I got some like cedar bedding, or you can use wood chipped bedding, and he's got a blanket in there because he likes to hide and be cuddled up in that. As for food, you can use water bottles like this for them to drink from. And I have a sample of just a little bit of rat formula that they make at any like pet stores, things like that, that's already formulated for them. And then here in a minute, I'll talk to you about restraint. Okay, this is my rat. If you want to see him here, I'm going to talk to you a little bit about restraints. So you can kind of treat him like a cat, where you can scruff him. If I get a good hold of him, hold on. Scruff him like this. That way you kind of have control of his whole body. You can grab his kind of back legs there so he can't move. You can restrain them like this. You can do a claw technique, which I'm not as good with yet. You can kind of claw him like that, have more control of the body, which, like I said, I need more practice. But most restraints are pretty simple. You kind of want to pet him, calm him down. This one seems to be a little bit of a nervous Nelly ever since we've got him, but I'm going to scruff him to show you his gender. The way you tell a rat's gender is just basically looking back in the back. It's kind of similar to cats. You can see his male anatomy here, his testicles down there. You can also flip him kind of on his back, well, more dorsal. And you can see sex identification too. You can kind of flip his tail and look. And that's it for restraints. Okay, I am ready to show you how to administer some medication, subcutaneous. So I'm gonna hold him like this. He's a little nervous, like I said. I'm gonna grab his scruff. And in that scruff, you can actually give the injection. Okay. I know, oh, he's cried. And that's how you give a sub-Q injection. You did so good, little guy. Okay. Okay, now we are gonna give a little bit of oral medication. So how I'm gonna do this is again with kind of scruff him up here. Where you going, little guy? Where are you going? Okay. So this is actually a little bit of water in the syringe. I'm gonna hold him up kind of like this and give it to him orally. I'm not doing a very good job. Okay. There we go. See, that's not so bad. He's taking it for me. There we go. And that's how you give oral medication. Okay, now we are going to draw blood from the tail of my rat here. He's sedated because he is very stressed. And you can see a little blue vein here. I'm going to try to start a little lower to get my blood sample. Okay, and I got a little bit of blood here. And it's coming pretty slow. But I'm gonna go ahead, since I don't really need a big sample, I'm gonna go ahead and hold off. Hold off for a few minutes. And that's how you draw blood. Okay, now we're gonna talk about the mouse. This is a cage I got for him. It's just actually one of these hamster cages, but we put chicken wire around it because I didn't want him to get through. But he's got an activity wheel. These guys like to be really busy. And there's a little bit of a tunnel that one of the girls made here at the clinic for him. He's kind of got some like wood chips or cedar bedding down there so he can burrow and go potty in that. He also has a bowl for his food. And again, that's one of those commercial type diets you can buy at the pet store that are formulated for rats and mice. So it's got all the nutritional needs that they need just in that diet. These guys their teeth do overgrow. They have an extra pair of incisors, so they have two in the front and they kind of come up. So you gotta give them stuff to chew on. So they make some toys and things like that to help kind of sand down those teeth so they don't get any problems from that. And he also has a watering bowl here that hooks onto the cage for him to drink from. You want to change their bedding. You should scoop out any like stools, urine every day. Give them fresh water every day, fresh food. You should interact with them at least a minimum 15-20 minutes daily to get them used to you. As you can see, the mouse is nowhere near as nervous as the rat was. He's very friendly, and he's been at the clinic for a few days now, so we're trying to get him socialized well. And here in a minute, I'll talk about restraint. He's in my tube. Come on out, buddy. Do some restraint. I'm gonna pick him up kind of at the base. Nope, he's not wanting to come out. You wanna go out this way? Okay, there we go. So when you're picking up a mouse, you don't wanna grab at the very end of the tail. That's a big thing that tail can sludge off. So you wanna kind of get the base of their tail, kind of hold them up like this. You have restraint. Let them grasp with their front feet. You could hold on to them. And with these guys, you can scruff them too. So you can kind of scruff that. Oh, I know. Their little skin there, get as much as you can. You can flip them over on their back. Kind of look at them that way. And then I'm going to try to get a better scruff, because you are a wiggly little guy. Okay. So I have really good hold of him here, his back end. And that way you can do injections and things like that way. But it's important to grab them kind of, like I said, more of the base of the tail and let them grasp with their front feet like that. Okay, now we're going to show you how you can determine the sex of a mouse. So again, you can kind of grasp them like that. And you can see, holding at the base of the tail, that this is a boy. You can also scruff them like that and hold them upside down and see their anatomy here. And again, there's his anatomy for his boy parts here. And that's kind of that simple on being able to tell the gender of a mouse. Okay, now I'm going to give a sub-Q injection to this little mouse here. So, I'm going to try to scruff him. I know you're getting frustrated with me. Get him a good grasp here on the crate. And I have a 27 gauge needle to give him. But I'm going to go in a second. I'm going to hold him pretty good here. Give the injection in the scruff itself. Okay. And that's how you give the injection. Okay, I'm going to do it from a different angle so you can see my actual injection a little better. So I'm going to scruff him. Come here, little guy. I'm going to scruff him. Let him get a grasp of the kennel here. And you want to go, that's not it. You want to go in the scruff. Pull back on your syringe and give the injection. Okay, and that's how you. Okay. Now I'm going to give him some oral medication. I've got a little TB syringe here. I'm actually just going to give him 0.1 of water, just so I can show you how to give some oral medication. Okay, little guy, I know you're over me scruffing you. Okay. Here we go. Oh, I know. You kind of like that, don't you? Okay. And that's how you give some oral medication. Okay, now we're going to talk about how to take care of a rabbit. Rabbits are really timid and they get scared at first. Sometimes you want to kind of cover their eyes, get them used to your smell, kind of pet them like this. This particular rabbit is one of our girls here at the clinic. Her name is Marley, and she lives in a chicken coop in her house. She uses kind of wood chips bedding you can get for small animals at the Petco's or PetSmarts, anywhere like that. Her diet consists of kind of rabbit pellets and some straw. And she also gets fresh fruits and veggies. It's good to have about 70% of your pellets and your grains and 30% of your veggies, like your carrots, things like that. You kind of want to get them some things to chew on. Carrots are good because you want to make sure their teeth get something to crunch down on because their teeth can overgrow. And now I'm going to show you how you want to restrain a bunny. I'm going to use a towel. Towels are really good for rabbits. You want to kind of keep them close to you. You can scruff them. I'm sorry, Marley. Scruff them like this and keep them kind of close to your body. I know she's a little nervous, so that's a good way of restraint. If you want to pick them up, you can pick them up, hold their feet, make sure their body's up close against you. I want to put her back on the table now. Another good thing with this, you can kind of wrap them up and have better control of them. They feel more secure and tight if you need to do a nail trim, blood draws, things like that. And you can use a nice warm towel. I'm going to show you how to do a ginger check on rabbits. So she kind of has her up for me. You kind of want to push down here, move some far out of the way and kind of push forward. And you're able to tell, girls have like a slit, as you can see here, for her vulva. And then boys, you can actually push in and it'll protrude their prepuce. But that's how you tell the gender of a rabbit. Okay, now I'm going to give Marley here a sub-Q injection. I'll go ahead and restrain her. Okay, so how you give a sub-Q injection is you scruff them like I did before. I'm going to scruff with my left hand because I'm used to giving injections with my right. So here's the scruff of the bunny. I'm going to pop your needle off there. And you give the injection in your little scruff of this extra skin there. Pull back on your syringe and give the fluid. And what I just gave her was a little bit of saline, just to show you how to do that technique. But that's how you give a sub-Q injection on a rabbit. Now we're going to draw blood on a rabbit, and we're going to use the bunny rabbit's ear. Chrissy's actually restraining and holding off for me. I'm going to grab a TB syringe here. And you can kind of see my vein right here on the side. I'm going to try to go ahead and get my sample. And I got in a little bit because I got a little bit of blood in my hub here. There we go. And I just needed to show you that we can draw blood. So I have some blood in my hub, so I'm not going to stress this bunny out any more than I need to. So I'm going to go ahead and hold off. But that is how you draw blood on a rabbit. Okay, now I'm going to talk about birds. And first I want to talk about understanding techniques of holding them and kind of maintaining them. So they need to be in a cage that they can spread their wings and have enough room. And they needs to be longer. Pause it. You didn't push it, did you? Okay, with the cage, it needs to be stainless steel because galvanized metal can have zinc in it, which is really bad and toxic for birds. The cage needs to be where a lot of people are going to be. It can't be near the kitchen because the fumes when you're cooking can really affect them and it can be toxic to them too. When it comes to feeding them, they have special food like seeds and things that they put together at pet store that you can feed them. They need to have about 70% of their seeds and that food that they prepare, and then they can have fruits and vegetables as the other 30%. They can't have any of our table scraps because too high of sodium and glucose, so it's harmful to them. Now we're going to talk about restraint. I kind of have a hold of his neck here. You want to use a towel, kind of protect your hands. It helps them feel more comfortable as well. So if you have a hold of their neck like this, you can take a look at them. You want to hold their wings down so you can get to their feet if needed. And then I will show you how to trim nails. Okay, now I'm going to trim nails. We have him in restraint. He's got a hold of the neck there and a towel for me. So I can kind of hold his little toe here. And I'm going to use regular nail clippers because it's easier to see. And I'm just going to tip the very end there. And then I'm going to try this other one right here. Okay, and that's how you trim nails. Okay, next we're going to talk about how to observe like objective data to find out kind of what's going on with your bird if they come into the hospital and they're sick. So you want to get a good detailed history, the environment the bird is in, how big the cage is, take a good look at their feces. If they are on a lot of seeds, they have a drier feces. A lot of the times, most medical conditions are due to poor health. I'm sorry. Okay, so a lot of their medical conditions are due to poor diet, so you want to get a good detailed history of that. You want to evaluate the bird by watching them walk on their perch and how their walking ability is and posture. That helps give good details. You also want to see how their sleeping habits are, their normal behavior habits outside the clinic and at home. A lot of the times you get a lot more on when the doctor does a physical exam, but this objective data can really help determine kind of what's going on with your bird. And it's also a really good idea to get a good accurate weight on them as well. That will only help the doctor find out how to medicate and how much dosing you need to give. So that is the end of my project. Again, this is for Lab Animal Health, and it's the class VTHT 2213, and I'm Hannah Bilthouse. My student ID is 2973725.